The impact of undiagnosed and untreated behavioral health in the American healthcare system is well known to contribute directly to increased costs and prolonged outcomes for anybody suffering from a chronic condition. What we're going to be discussing today is how new virtual care modalities are going to help expand and increase access to behavioral health treatment through scalability and improved solutions that meet patients where they are. Welcome back to Chilmark Research. I'm John Moore, and I'm the Vice President of Growth Strategy here. I'll be your host today with Lennox-Miller, who will be joining us to discuss what is happening in the world of behavioral health as it meets virtual care. But before we jump into things, please be sure to follow our page and click on the little bell button next to the subscribe so that you receive notifications anytime we post new content. And if you like what you see here today, be sure to like the video and leave a comment for someone to engage with you from our team. So Alex, tell us why behavioral health being treated in a virtual care, home care setting is important. Because as we've covered extensively in our coverage about telehealth, telepsychiatry is already well established. So why is this new or different?
So like you said, we've had telepsychiatry for a long time. And for most of the history of telehealth, telepsychiatry has been how most people used it. Now, as we move in the COVID pandemic, we're seeing the need to engage people much more rigorously. We're seeing that many more people have a need for behavioral health services. The metrics for depression and anxiety have skyrocketed, unsurprisingly. They're only going to increase due to the stresses of schools, of jobs, the employment market. All of these things are coming together in almost a perfect storm. We need more behavioral health tools because telepsychiatry as a telehealth modality simply doesn't scale enough to address the number of people who now need help and need services.
Can you elaborate just a little bit more on what the problem is with telepsychiatry as far as scalability?
Telepsychiatry is great for getting people access to a therapist or getting people access to a provider who can help them. The problem is there just aren't enough. We already have massive waiting lists and an incredible delay in being able to get a behavioral health appointment, even in places that have a large number of behavioral health providers. In rural communities, in underserved communities, that wait is even longer. Telepsychiatry is great for what it does, but it can't put more time into the day. It can't create more providers. And ultimately, that's what we would need to do to get everybody in-person appointments at the scale and as quickly as they need them. The other issue is specialization. Not all symptoms are the same. Not all depression is caused by the same thing. And ideally, you want providers who are specialized and who can identify and address not just the broad category, but the specific reasons why somebody is suffering or needs help. And that's even harder. So in-person care simply isn't enough. We don't have enough people, and we can't get enough as quickly as we need them. If we can have asynchronous solutions, or solutions that can help people when they need it, that don't remove the in-person relationship, but that help supplement it and provide more time for those providers to do that in-person care as it's needed, that addresses the breadth and the depth of what we need in terms of care and what we need in terms of populations.
Okay, so the big difference is tele is more about convenience and accessibility, whereas virtual is more about productivity gains and actual kind of adding to the overall experience.
Well, and while telehealth and telepsychiatry are fantastic for bringing services to patients, they don't do a whole lot to increase the productivity of the providers.
Exactly.
The appointment is still the same length. The paperwork, the documentation, everything else that they have to do to support that patient all still has to happen. As we start looking at virtual care tools that go beyond remote appointments, like you said, that's where we start to see real productivity gains, and that's where we start to see provider time freed up so that the really vital in-person stuff can still happen.
So Alex, can you tell us a little bit more about what the obstacles are to actually deploying and adopting these technologies, both from a provider as well as from a patient perspective?
Well, I'll start with the providers. The biggest obstacle probably is that there just aren't enough people engaged in behavioral health care. There's a real shortage of providers. There's a real shortage of people at all levels of license. And in order to provide really excellent care, you need somebody involved at some point. This is not something that can be completely automated. You can't take providers out of the equation. It's also not reimbursed as well as other types of virtual care. And the new reimbursement codes that have emerged supporting, for example, RPM, there's really no such thing as a glucometer for mental health.
No. There are very few biological actual measures to quantify it.
You can't do RPM for behavioral health in the same way. And so the ability to access reimbursement in a fee-for-service system just isn't there for behavioral health. For patients, the biggest obstacles are infrastructure, so having access to high-speed internet, having access to devices and technology, and frankly, they're cultural. People really hesitate to accept and address behavioral health needs. There are real significant cultural barriers. When you look at men over the age of 50, they're dramatically less likely to go looking or accept behavioral health assistance. One of the real challenges, if you're a vendor trying to create a solution, is that it's not one size fits all. You need to have a solution that addresses culturally specific, social specific needs that can address people in ways that they feel comfortable, get them help in ways that they will accept, because it's not one size fits all.
So thinking about that kind of cultural problem, or the cultural resistance to these types of treatment modalities, do you think that the virtual and having somebody not on the other side, actually having a computer, does that make it more accessible to these people? Do you think that'll actually make it more likely for some of these individuals to adopt the technology?
It really does.
Yeah.
Being able to access that care at home, not having to go to an appointment, not having to go to an office marked psychiatry, not having to sit in a waiting room of a behavioral health clinic. That takes away a lot of that stigma.
The stigma barriers.
Being able to do it in private, do it through an app on your phone or on a tablet, it makes it a lot easier for a lot of people. The other good thing is, as we see more focus on this, and particularly as we've seen more attention paid to these issues during the pandemic, we've actually seen significant growth in people's willingness to accept help. When people see that this is not something that's unique to them, that this is something that is broad, lots of people need this help, they become more willing to accept it. As we've seen athletes talk about their struggles with behavioral health, as we've seen celebrities and people in all walks of life talk about how these challenges have hit them and what they've done to help it, that helps people understand where they can go and what kinds of things they can do.
So what advice would you give to a vendor that's looking to develop a solution in this space?
I mean, the first advice I'd say is go for it. This is terribly underaddressed, and it is really surprising, given what we know, as you said, of how prominent behavioral health is as a comorbidity in chronic symptoms, how much it affects the total cost of care, and how much it hurts clinical outcomes. I would think that we would have seen more solutions before now. What I would say is, first of all, telepsychiatry is not enough. If what you're offering is access to in-person providers, that's insufficient. You need to have some kind of asynchronous or automated component to it, whether that's messaging, skill building, meditation, mindfulness. If you dig into the research, mindfulness has a lot backing it. It works really well. And it's something that can be automated, that you can teach people or assist people without having to have an in-person encounter. The other thing I'd say is that there needs to be some connection to overall wellness and to health, because that's why the reimbursement space and the execution has been so limited before now. As we start to move more into value-based care, and as we start to address integrated health more fully, people are starting to appreciate how much that matters. But these behavioral health interventions need to be associated with the overall well-being of the patient, with adherence to their medications or to their regimens, with their larger health landscape. It's not enough to just do behavioral health by itself, the same way it's not enough just to do chronic care by itself. They need to be connected.
Yeah, I mean, you're speaking my language based on my startup that I, worked on a number of years ago, which was trying to solve exactly this problem of monitoring both the adherence to a medication regimen, but also the other aspects of a behavioral health treatment regimen, which, to your point, can include mindfulness, exercise, social activity, any of those things that will actually help someone get the, right chemicals flood in their brain to get them back to a better baseline.
The other area where we're starting to see a lot of movement is in the hospital at home category. And this is another area where behavioral health is going to be essential. Everyone knows how important having access to behavioral specialists is in a hospital setting. And when you're bringing people care at home, they're going to need that same kind of support. Whether it's through telepsychiatry, whether it's through chat, whether it's through exercises and remote activities, they're going to need some kind of support. And again, it's going to need to be associated and correlated to the kind of care that they're receiving.
And
if they're getting outcomes. If they're getting home infusions, that's a different set of needs than if they're in PT following orthopedic surgery. They're both going to need help, but it's going to be distinct and different.
Yep. Okay, so let's flip that question. And if you're a provider looking to increase your productivity and serve your patients better, what should you be thinking about as you look to deploy one of these solutions?
At the very least, you need something that's going to be gathering information from the patient at home. It can be something as simple as just distributing screenings to them outside of encounters. If they're getting a PHQ and a GAD-7 on a regular basis, that at least gives you some insight into their state of mind and how it's changing and how it's progressing. If it has more robust patient-reported outcomes elements to it as a solution, that's even better, because that lets you associate it with things like medication side effects and really correlate it to adherence and making sure that things are going as well as they possibly can go. At the moment, that's really the ideal state, because there aren't a lot of solutions out there that go further. But there are a few. And if you find a solution that really enables training, education, reminders, engages people in a really interactive way, and teaches them the skills that they need going forward, that's even better. Because that's the area where now you're going beyond just, are things deteriorating, and how do we address that before they get critical, into really improving people's outcomes and improving their state of mind.
So Alex, all of this kind of retrospective perspective on where we've been and where we are today has been great. Can you tell us a little bit more about what needs to happen in order for this to be more fully adopted and to get us to where we need to be in the future?
Probably the biggest change that needs to happen is in reimbursement. We need to continue that movement away from fee-for-service towards more value-based and capitated payments. We've seen what fee-for-service does with behavioral health. What we need is to continue to grow and change reimbursement so that it recognizes the impact of the variety of potential care that a patient can receive on overall health outcomes. The other big change is technological. We need to take these various solutions and really tie them together, because that data currently is coming from a bunch of different applications, a bunch of different sensors, a bunch of different platforms. It needs to be tied together. You can't just have your behavioral health system, your chronic care platform, your doctor's EHR. They need to be brought in a single data platform that can conduct that sophisticated analysis that's needed to really provide visualization and predict what's going to happen with a patient, not just report on what's been happening.
Yep, that sounds like the ideal state for sure.
Yeah.
Hopefully we can get there soon.
Fingers crossed.
Well, thank you for your time today, Alex. This has been great, very informative, and I hope our audience finds it informative as well. If you liked what you saw here today, please be sure to follow us, and again, hit that notification bell so you actually receive updates when we post new content. And if you'd like to engage with us, please leave a comment under the video and someone will reply.